The Director General of the World Health Organization has said that vaccine equity remains an obstacle and that everyone is at fault. He was addressing a special ministerial meeting on vaccine for all, during which he described individual behaviors towards vaccine distribution as morally wrong. More of that in this report.
No one predicted COVID-19 itself, so also if it is a damage to economies and livelihoods mostly triggered by policy responses. With vaccine development, excess deaths and other hardships continue, dominating many low-income countries as vaccines access is still a hurdle. Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, describes the unequal distribution of vaccines as disgraceful and could make the virus more volatile.
The inequitable distribution of vaccines is not just a moral outrage. It is also economically and epidemiologically self-defeating. The more transmission, the more variants. And the more variants that emerge, the more likely it is that they could evade vaccines. And as long as the virus is circulating anywhere, the longer the global recovery will take.
110 countries have so far received vaccines through the COVAX initiative, but this is far below expectations.
We know that some countries and companies plan to do their own bilateral vaccine donations, bypassing COVAX for their own political or commercial reasons. A scarcity of supply is driving these bilateral agreements, which only increases vaccine inequity. This is a time for partnership, not patronage.
Henrietta Fore, Executive Director of the United Nations Children Fund, calls on countries with excess doses to give them out to developing countries. Dr. Ngozi Okonjo-Iweala, Director General of World Trade Organization, describes equitable distribution of vaccines as crucial to economic recovery.
This situation is self-defeating for both public health, as we've heard, but also for the global economic recovery. Vaccine policy is economic policy. As Secretary General Guterres has said, vaccine equity is the biggest moral test before the global community.
It is 114 days since the beginning of the vaccination campaign, with 590 million vaccine doses being administered so far. However, 77% of this achievement is confined within 10 countries. Research reveals that most people in African countries will not be vaccinated before 2023, and emerging countries will have to wait until 2022. The UN General Assembly, the World Health Assembly, the UN Secretary General, and the Director General WHO have all called for COVID-19 vaccines to be treated as a global public good and for equitable access. For iAfrica TV,